Welcome to TRS Clips, where you'll find happiness through your own curiosity. I want to know about the prostate. What is it? Why? What is its function? Why do so many old men all over the world have to get it removed? How much does it hurt to get it removed? How much does it hurt to get it checked? Give me like a 101 on all these things.
So let us talk bit by bit. The first thing is, prostate is a small organ like the size of a walnut, and it is situated between the reservoir, which is the urinary bladder, and the conduit, which is called urethra. So there is a reservoir, which is urinary bladder, and there is an exit, which is urethra, and prostate is around this urethra. So if you see a pear and there's a central core, so the central core is the tube through which the urine passes, and the spear is actually the prostate. So imagine that there is a bladder and there's a urinary passage passing through the prostate. And the role of prostate is to produce semen. Now, semen is different from sperms. Sperms come from testes. Semen is the fluid in which the sperms thrive, because they need a medium to be carried to their work. So semen, the seminal fluid, which is maybe 2 to 5 milliliter every ejaculate, is being produced by glands within the prostate.
Swimming pool water.
That's right. That is the medium through which the sperms move. So it is controlled by testosterone. It's a male organ, so it is controlled by testosterone. And slowly over the period, over the fourth decade or so, there are changes in the hormones. There's a balance between the estrogen and in the testosterone. That ratio slowly starts changing as you start accumulating fat, and the peripheral aromatase comes into picture, and something goes wrong with the proliferation of cells within the prostate, and it starts proliferating. It starts proliferating, and imagine there is a kind of an organ through which the urinary passage is passing, and this organ decides to increase in size. So if it increases in size, there are two options. If the outer shell is elastic, it will expand like this. If the outer shell is tight, it will compress the passage.
So it hurts while peeing.
No. So the person has frequent desire to pass urine. He has urgency, so that when he is sitting here, he has a desire to pass urine. Before he reaches the washroom, he leaks.
Oh my God.
Then he reaches there, he starts to pass urine, and he realizes he is not able to start the stream. Even after some time, when he starts the stream, he takes longer to evacuate. Towards the end, it is a dribble. He keeps waiting. He then gets up and zips his sample. He is trying to come back. He has again a desire to pass urine, so he goes back again. So there is a sense of incomplete evacuation. So there's a frequency, urgency, prolonged stream, delayed stream, broken stream, and sense of incomplete evacuation.
Does this happen to all guys?
No, fortunately not.
Why does it happen to so many though?
Yeah, so there is some familial transmission of this. So all men will have some, we call it benign hyperplasia of prostate, or BPH. So all men beyond 40 years of age will have some BPH changes. If you do autopsy of these men, you'll find that histologically or under microscope, you look at those tissues, there'll be BPH. But that is histological BPH. That is not clinical BPH, means it does not give symptoms. So not all people who have an enlarged prostate will get symptoms.
What is histological?
Histological means what we see under the microscope.
Okay. Which is not available to the naked eye.
That's right.
And or feelings.
Yes. So
Gotcha.
You don't know, but that is autopsy. So for example, there are patients who will come to us with a prostate gland. Normal prostate gland is 20 grams. So I often get a call at 10 o'clock from somebody who gets my number and says, "Doc, I've got into trouble. I'm just 45 and my executive health checkup told me that my prostate is enlarged. I want to see you tomorrow morning." So I said, "How can I do that?" So how much is the prostate? Is 25 grams. Now, the normal value which has been designated by the ultrasound is 20 grams. But you have a 25 gram prostate, which means that that's okay. It is growing, but is it causing you trouble? That is where we need to understand that it should not cause trouble. If it is not causing trouble, let it be. Because it is then one of those prostates where the capsule is too elastic and the increased volume is being taken by stretching of the capsule. So there will be men who would have 200 grams prostate without an issue.
Couple of questions. One, you have to do prostate examinations regularly. Doesn't it hurt? Doesn't hurt the guy with the bum?
So if it hurts the patient, the fault lies with the doctor.
Really?
Yes.
Technique. What is the technique?
The technique is you have to explain, make the patient comfortable. There is a muscle that is very tight. You have to allow it to relax.
Which is naturally loose, but when you're nervous, it becomes tight.
Exactly. So if I'm trying to push my finger through that door, I'm hurting him. You lubricate it well, keep talking to him, distract him, and slowly. And there is a way. You don't put it like this. You put slowly, like a thief you enter. Nobody knows that you've entered. That is the trick. So there is a lot of variation, individual variation. So many patients will come and tell me, I won't like to get it done. But once it is done, they say, oh, is it done? Last time I had so much of pain. So they have a bad experience. But then it's an individual training. It should not hurt at all. And if it is hurting, it is the problem of the doctor who has done it. Now, why do we need to do that test? We need to do that test because we are looking whether there is an enlargement of prostate or not. If a person comes to me with the symptoms, I want to see if the prostatic enlargement is the cause of symptoms. So I do that examination. But today we have ultrasounds. So I simply ask for ultrasound. Ultrasound gives me not only the weight, volume, also gives me the shape. And then I know, okay, and the effect of prostatic obstruction on the bladder, trabeculations or cystitis, whatever they call it. So you have ultrasound which can tell you that yes, prostate is enlarged. Then why do you need to put in a finger?
Why does one need to put in a finger?
One was to ascertain that the prostate is enlarged, which we do now with ultrasound. The second was to exclude cancer.
You can tell from the touch.
That's right. My finger is very sensitive to pick up a cancer. But the problem is now that we have two tests called PSA, a blood test called prostate specific antigen, and an MRI. So if a person comes to me with a normal PSA, I don't have to do a rectal examination to say that you have cancer or not because the PSA is normal. So I have to watch him. If the PSA starts rising, if there is a serial PSA rise, then I know there may be a cancer. That is the time when I will touch it and see if there is a cancer that I can feel or not. If I can feel a cancer, I order a biopsy. If I don't feel a cancer, I order an MRI.
What does a cancer feel like?
Hard, like a stone there.
Like that's a
So
tumor.
normal prostate is like the tip of your nose.
Like soft.
That's right, firm. We call it firm.
Got it.
Soft will be this. This is firm. So if there is a nodule, there is like a stone stuck there or a pearl stuck there. So you feel and suddenly there is a pearl. So you know, yes, this is a cancer. This could be a cancer. So we are able to do it. But then now today when we have a PSA which is high, we can do an MRI. An MRI can tell us whether there is cancer or not.
So
if we are still in doubt, we should still look at it. Then we should still look at it and see, okay, if I can feel it or I cannot feel it. Because I have to take a biopsy.
Sure.
Then another reason why I should put in a finger is when there is a diagnosed case of cancer of prostate and I need to do a robotic surgery, I need to feel the prostate and see whether it is stuck to the rectum or not. Will I be able to remove this prostate? Can I find a plane between the prostate and the rectum? Will I be able to safely remove the prostate and not hurt the rectum? So all that information a surgeon will get only when he feels the prostate. So these are but now they are very far and few in between as compared to what it was 25 years ago.
Hey, if you enjoyed today's clip, make sure you check out all the other clips we've uploaded on this channel. You'll find a clip related to almost every single topic as long as you're willing to search for it.